Good morning, good afternoon, and good night to all the followers of Medical Mavericks. I am one of your hosts, Caleb.
And I'm Tevin.
Hey, and we're here with Medical Mavericks. So we're going to go ahead and update y'all on, what's really been going on since it's episode 3. So now it's episode 4, officially in the books.
Yes,
and,
sir.
I had to bring out my Atlanta shirt, it's on for it. So I had to pop out a little bit. So I appreciate all y'all supporting us so far. And, we just going to keep it going, keep it flowing.
Oh, yeah.
So what you got for us, man?
Man, nothing, man. Not much, man. We just over here trying to get this knowledge.
Hey,
you know what I'm saying?
true?
Get these patients right, and, like we do always, we like to come with some information, some stories, you know what I mean? Get something for us to all kind of think about, doing our job, you know what I mean? So,
Speaking of stories.
all right, we're going to have a moment of silence for Kansas City Graham Hoffman, firefighter paramedic.
Mm-hmm.
All right. Next, we have Battalion Chief Frank Harwood from the Kootenai. Did I say that right? Kootenai County Fire. And also John Morrison from Kootenai County Fire. So with that being said, me, I don't know about maybe a handful of what happened to these firefighters. So, just like the viewer, I want to know what happened.
So we can go ahead and start with Graham Hoffman, RIP to him. So basically what happened was he was in transport en route to the hospital for a patient, for a woman. I don't know what age. So basically en route during transport, she just decided to stab him in the heart. And he didn't make it, sadly. And that's why we got to be real careful with transporting specific patients, making sure they don't have any weapons that they can get into back there, or check their book bags, because there's some people with serious mental illnesses out here.
And that's really sad to hear, because I just came off of vacation, right? Mm-hmm. And for some reason, like when I leave this job for a certain amount of time, when I come back, something just hits me where I'm like, dang, bro, I really got a dangerous job. For real.
Like I could really die.
Yeah, you know what I'm
I could
saying?
really
And
die.
I don't really, for some reason, I don't think about it until like I said, I had like a long break.
Right.
And then I come back and I'm like, dang, why am I doing this, bro?
Yeah.
Like this shit is really dangerous.
But it's real fulfilling though, because especially depending on whose territory and stuff, like you get people back with ROSC. You're actually helping that older lady, have a conversation, because nobody really checks in on her. Mm-hmm. Her neighbor's the only one driving her to her appointments and the hair salon and stuff. So, it also goes a long way. And that's why I try to push forward for the EMS side, because that's the real, personal side. I know that, understand that we can all run into a burning building. We all want to make that grab. We all want to chase the orange, the orange glow. I understand that. And that's why we got, a soon to be show, Fire Mavericks to the side. We're going to talk about that later. That's later on, and neither here nor there.
Yeah.
But that's why I harp so heavily on EMS, because that's really dealing with the people, honestly, and whoever you're serving in your community that you're serving.
Right. And what's kind of crazy about what you just said, because that's kind of how I think. I kind of think if anything, knock on wood, that were to happen to me, it's probably going to be something fire related. But with this firefighter, you know what I'm saying? He got killed on the EMS
he
car.
was just transporting,
and it's just like, dang, like anybody can get you. You know what I'm saying?
Like,
and it's just like,
bad.
it's really sad to really think about, man. But, like I said, like our job is pretty dangerous, man. But, I guess it's come with it. Like he said, there's the good side to it. You know what I'm saying? So prolonging somebody's life, saving somebody's life, bringing in life. You know what I'm saying? All that good stuff. But, this job is like, man. Like, I don't know if you've seen that video. I don't know. Maybe it was like last year where I think it was a chief. He had opened up the back of a.
We could really get in that. Okay, so basically, what story that he's talking about is there was an 18-wheeler.
Yeah.
It was an 18-wheeler truck, and I don't know what was burning on the inside. I can't remember. I don't know if it was. I think somebody said it was either like turkeys or something, but in there in the container, it was basically heating up. And you could literally tell from the size of the trailer turning into a bubble that it's about to blow.
Exactly.
So, it's also a training video on YouTube, and thank the family that allowed for it to be shown on YouTube because I heard that, you have to go through the family to ensure that they can use this for training purposes, and that we do definitely use that for training purposes. And I believe, I can't remember which county it was, but we all went over the video. We've all seen it. Basically, he went back there, he opened the door, and it went from 0 to 100 real quick. And I'm not going to go into details about it, but when you open up something real pressurized, things happen. Yeah. I got to go get their names so, we can also talk about them. So
yeah, because that was a crazy video.
And it was quick.
Yeah, it was crazy.
It was so quick. It was scary quick.
Yeah, so it's just like, hey, so for the viewers here, you know what I mean? Like he said, it's a pressurized container that's on fire, right? So basically, you know what I'm saying, get down to science. Imagine the atoms in the 18-wheeler is doing this. Mm. So when you open it, where do you think those atoms are going?
Gotta go.
They going, you know what I'm saying, straight to, least path of resistance, right?
And as soon as that lock came off,
that's it. You know what I'm saying?
And that's how quick, and that's why I try to harp on, doing this medical stuff, because, I feel like it helps.
Yeah, it's crazy, man. So like I said, the job is dangerous, man. But you know what I'm saying, getting back on track with the remaining firefighters here, though. Mm-hmm. All right, so
Battalion Chief Frank Harwood and John Morrison. So rest in peace to them.
And that's Kootenai County Fire, right? Mm-hmm. And that is the fire where...
So that was the scenario where there was a guy doing the recruitment process. And so when they did the recruitment process, I guess he didn't either pass the physical agility test, or he was rumored that he was too short to be a firefighter. I don't know how accurate that is, but he didn't pass the test the first day. Wanted some get back, I guess, the next day, or he thought about it. I don't know how long, but he wanted some get back, so he set a fire. Mm-hmm. Just a random day, just set a fire, arson, and they showed up. He showed up with firearms. Yeah, showed up with firearms and just sprayed and prayed.
Dang, man. And I heard about this. I think we all kind of heard about it, but really putting yourself in that situation, imagine you about to call, you got called to a call, it's fire call. Yeah, you know what I mean? And I hate to get like
tunnel vision.
It's just like you hype because you about to fight that fire, you know what I'm saying? Yeah. So you tunnel vision, like you said, you focus on this and imagine your
heart racing.
Yeah, your heart racing, and it's that pressure. And people don't really realize that when you about to go fight a fire, one of the hardest parts is like the psychological pressure, and that has an effect on your body. It make you tired. Mm-hmm. It's like fighting. It's literally like fighting, right?
Like fighting.
So with that being said, imagine you know what I'm saying, you focus on one thing and your homeboy is getting sniped. Like, I don't even think I could process that.
Like, that's imagine warfare type of thing.
Yeah, you just seeing someone drop on the ground. You just like
we have the bulletproof vest, but we don't. This wasn't one of those calls. This was just a random fire call.
You ain't got no bulletproof vest on, gang. That's
it.
Like that's it. You know what I'm saying? So it's just sad, And then he killed 2 people.
Yeah.
So how many people got shot in the whole ordeal?
So basically, 3 people were shot.
Okay.
John Morrison and Frank Harwood were the 2 that were killed.
Okay.
And 1 survived.
Okay, so it's crazy to think because, I mean, I don't know what type of gun he had, but for 3 separate people to get shot, like, how, I mean, because naturally if someone got shot, obviously people would disperse and all that good stuff. So I'm thinking as a firefighter, if someone got shot and then 2 more people got shot, there's probably shocked, like, what's going on?
Like, we're fighting a fire, next thing we fighting bullets.
And that's what I was saying before, like how you might not be able to process that in that type of situation. Which is why, what I'm saying, the job is so random.
And we harp on safety and, updating our protocols.
Yeah, it's crazy. It's just like, even like, what I'm saying, with Graham Hoffman, what I mean? Like, it's not, you ain't gonna expect that. You know what I'm saying? And it's just like, it seems kind of unavoidable when someone is someone's intention to get you up out of here. Right. Like, you know what I mean? You know what I mean? Of course,
they want to do it. They just gonna do it.
Yeah, it's just like it ain't really not. It's kind of sad to kind of think about it that way. But I mean, but yeah, that's the crazy thing with this job or any first responder, man.
Right.
Like it's random. You know what I mean? And it's sad. And it's kind of like, what lesson to really? That's another thing. What lesson can you really even take from this?
Train better. I mean, not necessarily train better, but just keep doing your job and showing up. I mean,
that's all you can do.
Keep doing your job and showing up.
That's all you can do. Just because this is not even like like skill related death. It's just random, and it's sad, man. My condolences to the families of these firefighters, man, because it's really sad, man. And again, like I said, it really make you think about your own mortality, you know what I'm saying? Coming to work every day or every shift, you know what I'm saying? It's like, man, but boy.
Things happen. Yeah. And this is what we signed up to do.
Yeah.
As first responders.
Yeah. Yeah, man. So, So with that, was this considered like a mass casualty event or? I
think, what is it, 2 or more?
Yeah, technically.
Yeah, technically 2 or more. So basically, they probably had to IDLH.
Yeah.
IDLH the environment, have like 100 feet hot zone. I think it's like 100 feet hot zone.
Yeah.
I forgot what the breakdown of it is, but basically they have a hot zone. They have where they're getting recovered at, or where to stay at a safe distance. Then they have the recovery outside of that ring, I believe. Mm-hmm. So that's where they're recovering, far away from the actual environment where people have been shot.
Yeah. Oh man. Because I haven't personally had a mass casualty event yet. So I mean, hey, we're gonna knock on wood, but it is. But what Atlanta's like? What the worst drivers? Really?
Like we got like almost like the worst drivers out here. I think considered some insurance research not too long ago. Basically, they were saying there's bad drivers, and honestly, just one bad car accident could be a mass casualty. Honestly, you really never know. That's why I want to harp on sharpening what you can do in your scope of practice. Like you honestly really never know what's really going to happen, and that's why we continue with these episodes to bring awareness.
Yeah,
and just let people know like this is what is really going on, and however y'all feel, we feeling it too.
I hear that, and I wanna bring up something that's kind of related to this. Mm-hmm. But one thing this job has kind of taught me for real, I ain't gonna lie, is like the power of the tongue. So yes. I wanted to knock on wood so bad.
Okay, what's up? Talk to us.
But what I'm saying, with all this, I guess, bad juju, what I'm saying, I'm talking about this sad stuff. But I noticed with this job, what you say, like, it's coming. Like, if someone be like, I remember I heard someone was like, oh, man, I ain't getting no CPR yet, da-da-da-da.
Nah, they crazy. They ain't at no busy spot. That's why.
Exactly. Exactly. And guess what we get? We end up getting a CPR.
End up getting that type of call.
It's
man, crazy. We just had... So let me harp on. Let me tell y'all a real story. Like I ain't gonna lie, I'm real self-aware.
Yeah.
So it's almost shift change, right? As a matter of fact, I think it was shift change, and the next shift showed up, but we decided to run the last call because we were just like, all right, we still got our gear on. We're gonna run the last call.
Yeah, right.
So the last call ended up being a pediatric arrest. Dang. Yeah, it was pretty bad.
Dang.
So
talk to me about it. What happened?
We get there.
Dang.
I ain't gonna give specific details or whatever. We get there, we're working the baby, but the baby had bad internal bleeding, and we don't know or understand why or where it's coming from. But we did everything in our best abilities to possibly resuscitate the child. But sadly,
dang,
we made the transport to the hospital, and we just transferred care. I don't know what happened after that, but I think we can all.
Yeah, that's probably what probably happened. That's
yeah,
probably good
but.
Dang.
With that being said, I feel as if when I deal with calls like that, and then I try to go be normal outside of work, like I got a lot of pent up aggression. Like it's bad, like for lame stuff, and I feel like it makes me not necessarily lash out, but you got Atlanta heat on top of folks being sassy and just like I don't like the peanut gallery 2 cent type of motherfucker. So like so there's constructive criticism. But then there's just blatant disrespect. Like you just coming out of nowhere left field, and I ain't going to into specifics, but it's somebody just coming so left field. You just like, bro, like, who are you? Like, for real. We take constructive criticism well, but like, who is this? And we ain't going specifically into who. But when you deal with a pediatric arrest, we have to figure out a way, just to relax and decompress from the call. And I was decompressed. Everything was good, but I don't know. I just felt like I need to go do some boxing or Brazilian jiu-jitsu or something. I need a martial art.
All right, so I got a question about that regarding like the psychological, I guess, trauma that technically that's what you went through. So like, how do you feel like talking to someone, you know what I'm saying? They got like resources like EAP, all that good stuff. Do you feel like that actually helped?
So they had EAP came out. Okay. EAP is good. EAP does their job. EAP was good. But for me personally, I mean, I just did necessarily what I'm trained to do and how we were taught to do it with pediatric arrest. The baby wasn't nothing but over 2 months old. So, we had finger compression. So we had to like this. Or you could do thumb compression, whichever one, either one, it doesn't matter. You can use your index and your middle finger to pump the baby's chest. You can either do this way or you can do the 2 thumbs to pump the heart. So that's what I mean by the finger method. No pun intended.
So still 30-2, right?
Yes. Or 15-2, with 2 people.
2 people. Okay, cool. All right. So that basically means 30 compressions.
And 2 breaths.
And 2 breaths. All right. So everybody on the same page.
And when you have a partner, it's 15-2. So it's just cut in half.
Yep.
Less work, but, more effective practice.
Okay.
But yeah, we did the best we could do. So
being in that environment, so obviously pediatric, that's no one want pediatric calls. Me personally, A, because it's sad, but B, the environment got to be crazy.
Yeah.
Parents yelling, cousin, whoever, daughter. So how is it like performing in that environment? Because I never had nothing like that. Knock on wood again, because I know how the universe get down. But
I don't even think about knocking on wood. Like it's times where random calls really honestly just happen, bro.
Get you,
like you can't predict this stuff.
It just happens.
Like you can't, like, somebody's femur could be popped out. Like we can't predict this stuff. So with that being said, it wasn't a big family thing. I think it was the babysitter and another family member. So yeah. So that's it. I ain't going all in detail about it, but I think that's what.
I get it. Yikes. I get that, but dang.
But yeah, sharpen your skills. Do your training, and level up. Cause I definitely want to go medic. I'm looking at some classes now, so I can go medic.
Okay. Dang, man.
Cause honestly, when you think about it, you want to be the most trained in your field. So you would want to go medic, which I do, and I've been saying since episode 2. Yeah. Yeah, it's been a while. Life been lifing. Life been lifing, but it's going to happen. So you just want to be the best trained in your field so, you can make the call or you can call the shot or, you can get the med. But it's also certain, medics that weren't good EMTs, but you have to be a good EMT to be a good medic. So it's some people that, get that power, they barely practice it, they don't do nothing, they got bad attitudes all the time, not a lot of patience. And I get it. We do get a lot of BS calls. We do get a lot of them. Some people just want to talk. We get a lot of them, but you got to have that little patience. And I'm a person myself that I got to tell, I got to have patience for this. Cause it be some BS calls.
Dang, man. So other than a pediatric call, have you had any other, difficult calls since the last episode?
I'm gonna tell you this. On a lighter note, let's talk about like the good calls. Okay. On a lighter note, so it's this guy, retired Atlanta police officer. I think he retired a sergeant. He's married to his wife, and they've been married for 63 years.
Dang.
63? Dang. Yo, that is beautiful. And every time, it's not often that we go there for emergencies, but lift assist, and he just need help off the floor. Sometimes he slip. Yeah. But he's still, mobile and stuff. But I really appreciate their marriage. I'm like, hey man, I know you ain't marry her just for good looks. I know she getting down in the kitchen, and he always be saying that she bossy when we come on scene and talking about it, but it's all love at the end of the day. I'm talking about real love. Like,
I don't think I've heard in like 63 years.
Seriously, 63. Yeah, that's your whole life.
How old are they?
I think they early 80s.
Okay.
I think early 80s.
Dang.
Yeah, I think definitely early 80s, but they still moving and grooving.
And you only as old as you feel. You're only as old as you feel. Don't give us the excuse that, oh, I'm too old, I can't do that. It was just 80-year-olds I saw, just squatting the regular bar. Yeah. No weights. You just got to get up and move the muscles. Because you lose about, 40% of muscle mass after 60? I think after 60, you lose 40% of muscle mass.
At what age do you start? I think you start losing at 30, right? Or something?
No, I think it's like 50 something to 60. I think it's around that range.
Good,
I don't know exactly, but I know after 60 you start losing 40%. Like
40%.
So you gotta move.
Yikes.
Gotta move.
Yeah. Okay, so we got. I mean, honestly, I hate to be lame, but you know what I'm saying. Mm-hmm. I'm at a station that I'm at a station that don't really be running like that. So since the last episode, I don't think I've gotten any like interesting calls. Most of them is like BS. You know what I'm saying?
But we treat it as a real call.
Yeah, you know what I'm saying. Still,
we know. It's BS.
Yeah, we still, you know what I'm saying, try to take the opportunity, you know what I'm saying, and, like he said, sharpen our skills. I've been trying to, hey man, I ain't gonna lie, man, IVs. I've been struggling with the IVs.
There's some people you really can't just can't get an IV on. I ain't gonna lie, I'm the first to admit it. Okay, so I'm the first to admit it. Sometimes you just can't get the IV, but let me tell y'all about this one call.
Yeah.
So we up in Buckhead.
Okay.
Obviously. Uh-huh. We're dealing with different demographic.
And so basically it's at a bar and, she had a little too much to drink and she didn't necessarily pass out, but yeah, she was blacked out. Mm-hmm. And so we get there, everybody just like, la, 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 like, what's her name? Who knows her? We got properly escorted straight to her. Mm-hmm. It was good getting straight to her, but, it just I didn't feel that tenacity to like do the patient care. And I checked her blood pressure. It was low. And I was just like, where the IV bag? Because nobody else was trying to do it. Yeah. I was like, bro, where the IV bag? Yeah. Like, let me at least try. So if you don't try, you're really lame.
Yeah, right.
So you at least got to try. So I'm looking at him like, so nobody wants to try the IV? All right.
Yeah,
give it to me. I mean, didn't get the IV, but at least I tried.
Yeah. Look good trying.
Yeah, look good trying, but didn't get the IV. Yeah. So, and by that time, Grady showed up. So it was a transfer of care.
Okay, that made me feel better, man. Because I be trying, and I get the flash.
Yeah.
But it's advancing that catheter. And, man.
But, we don't have... So, Grady has the ones that automatically stop. So, when we get that blood flow and we got to hold the vein so it doesn't flow too much or they'll bleed all over the floor.
Yeah.
I can't remember what it's called, but they basically have a different needle. And I got to... Man, I was just talking to somebody about this, basically. But... The catheter that's in their arm, in our department, we have to hold the vein so they don't bleed all over the floor. But Grady, they have one where it's no flask. So you have flask, but when you advance the catheter and you take it off and you're connecting the INT and the blood doesn't flush back. Like they have a no flush back. Yeah, like it just stops right there at the catheter. Like it's a no bleed back. No,
that's clean.
Back. I don't know specifically what the term is, but they have better needle gauges than us. That's what it is. They have better ones than us.
Nah.
All right.
But yeah, that makes sense though. Okay. All right. Well, I feel a little bit better about the IV look. I'm just keep trying, man.
Yeah, no, for sure. You got to, man. Very important to train. But what we also got over here, we got some QR code stickers, man. Check us out, man. Go ahead and show the people with the logo for the YouTube. Shout out to, I think we have 61 subscribers.
Nice. We'll take it.
So we appreciate y'all because we definitely only had 3.
Like a couple of years ago. Definitely only had 3.
Hey, we definitely appreciate anybody tuning in to kind of try to get these stories and knowledge.
No, absolutely. And it's also better for us and, better for me, myself, to just come on the show and, talk about the calls I run.
Yeah.
Or we run.
Yeah, it's really therapeutic to be for real. You know what I'm saying? Especially when you had a rough call, man.
And people like our stories. Like, obviously we doing something right. I'm guessing. We doing something right. So let me see how many we got. I think it's definitely 61 because I was trying to go live and we got 61.
And if there's any, you know what I'm saying, medical professional, they got some stories, you know what I'm saying, that they want to share, hey, y'all welcome to come through, man.
Yes, come and get interviewed. And it's not even necessarily an interview. First off, it's pre-recorded. So nothing's going live stream. If you're worried about live stream, nothing's going live stream. You have an obvious spot right here. So, you know, like, just come and tell your story on how you got to where you are. It's always kids that want to know, you know, I just had a function, not a function, but organized event. And I think it's kids touch a truck. So basically, like, all the worker trucks, down to the people that fix the signs. I don't know their actual job, but down to the people that fix the street signs. Everybody had the camper kids come out, like, literally everybody's a maverick. Everybody is a maverick. Trash maverick, you know, police maverick, you know, breast cancer survivor maverick. Like, the possibilities are endless. So that's why I went ahead and also, I don't know if y'all can see, but went ahead and put the logo on the hoodie.
And I won't even lie to y'all. Hey, it's some good texture. I ain't gonna lie to y'all.
Went and put the logo on the hoodie, man. We are the brand. So, hey,
hey, when they can expect these hoodies, man?
Hey, whenever the people ready.
I feel it.
Whenever they ready, because, you know, it's everything costs.
I feel it.
So,
keep it real. I feel you. Hey, I'm gonna definitely get me one though, man. Oh my goodness, boy, that. All right, that's right. So, like I said, guys, we're gonna have some apparel coming in soon, but today I want to introduce you guys to a new segment. Woo woo. It's called Drug of the Day. We're going to get you guys educated over here, all right?
All right. So we're going to go ahead and start with ibuprofen.
Okay.
Ibuprofen is a pain reliever and fever reducer.
Okay.
In simple terms, it's a medicine you can take when you have a headache, muscle pain, back pain, menstrual cramps, toothaches, or even a fever.
Okay.
It works by reducing inflammation, which is your body's way of reacting to injury or irritation. Think of it as a bouncer that helps calm the body's fire alarm system so you don't feel as much pain or heat.
Ooh, okay.
So think of it like, you know, think of it like that. Common brand names of the med are Advil and Motrin, and you can get it over the counter without a prescription. And
that's helpful.
Yeah, that's it. And make sure you eat and have something on your stomach as well.
So it's basically, you know, general pain relief. Okay. Hey, look, simple, straight to the point.
And that's our drug of the day.
Yes, sir. Yes, sir.